long from childhood, I always wanted to do something else extraordinary if I could.
99 FM, your inspiration station. It is Sibo in the morning, and I'm joined in studio for this royal hustler, someone who I admire thoroughly, Dr. Bernard Haufiku, who is a member of the executive board of the WHO, and he has studied medicine at the University of Witwatersrand in Johannesburg. He's received training in anesthesia from the College of Medicine of South Africa. He's also been privileged to attend the Harvard Leadership Training in Boston, Massachusetts, and he has over 20 years of clinical experience, both in public and private sector, during which he took a very keen interest in HIV management, and thereby becoming a member of the International AIDS Society. And he was also quite serving us beautifully here in Namibia, the Namibia Minister of Health and Social Services from 2015 to 2018. And now the job still continues, the work still is forging forward. He is now the founder and current chair of the Africa Public Health Foundation, which we will ask him about and what that entails and how it fares on the ground. But for now, I want to know the man before the man that we knew him. Doctor, welcome to the show.
Thank you very much, and I appreciate having me here.
I was teasing you off air about your lemon water. So you really are healthy. You you practice what you preach. You don't just preach it, you practice it. Because usually we would offer people cappuccinos and coffees. So it was interesting for us to see, there's lemon water, warm lemon water.
Yeah, it warms your body, and it doesn't put in anything to pump up the adrenaline.
I see.
So it's quite good.
Yeah. So tell us about your childhood, doctor. What was it like? How did it shape you?
Well, I had a difficult upbringing or childhood life. Just born basically at the dawn of the war for liberation of Namibia and Angola, and right at the border with Angola, actually, at a small village called Oneleiwa. There are two Oneleiwas now. There's one in Congo and there's one from our side. So the name itself means nice place. But nothing much was nice. In childhood.
No.
So basically we grew up as little kid looking after cattle, the few cattle that my parents had, and few goats. We are 3 siblings. One passed on about 2-3 years ago. We are only 2 now. My brothers are twins, and I'm the last born.
That I did not know.
That would mean I should be spoiled, but
I was about
had a
to
tough
say
time because my mother didn't have any girls. We basically did everything a boy or a girl would do
in the
stamping
home.
mahangu, looking after cattle, but also going to school. School was very difficult because sometimes you don't have to go to school because you have to look after cattle. And it was during the wartime. We witnessed a lot of stuff happening there in the border, between the border between Angola and Namibia. And I left the former Ovampuland at the age of about 12. Went to Okahanja. It was even worse.
It's not getting better?
Yeah, it wasn't getting better. I mean, to get food basically was a daily struggle. Just something to put in his stomach. And when I say this now, people will probably think I'm fabricating. It's true. I had very, very difficult upbringing.
So, doctor, how does a child who is from, a war-torn village to starving to becoming a doctor, how did that happen?
Well, there's one thing that just never left my DNA or my life at any time. It's just determination to become somebody. Long from childhood, I always wanted to do something else extraordinary if I could. How I left the former of Ambuland, I was impressed by kids who came from Okahanja who could speak Afrikaans and Oshirero. And particularly Afrikaans, because that was the lingua franca by then.
Yes.
So I also wanted to speak Afrikaans because children in Novambuland were not speaking good Afrikaans. So I decided I'm going to Okahanja. So I went in. Within a year or two, I was really able to speak Afrikaans and Oshirero. Then obviously I was taken by a Catholic nun, because I'm a Catholic, by the way. I was taken by a Catholic nun from Sampu in Kavango East. And I really want people to know that. She's the late Sister Pelkrina, who took me from Okahanja to Debra Catholic School in a hostel. And her words were like this: "You young boy, you look so thin and you are starving here in Okahanja. I think I need to take you to a hostel." So I was taken to Debra, and that's where I matriculated, or I finished grade 12. Also under turmoil, because we had the worst school boycott in the history of Namibia in 1988. But we managed to write our exams and qualify to go to university. By then we used to call them exemption, vrystelling in Afrikaans. So I managed to first go to Cape Town, do some BSc, and then went to Johannesburg to study medicine.
There we go.
All along, I was motivated by just becoming somebody.
That's the motivation that keeps us going. We're talking to Dr. Bernard Haufiku, and now I just want to find out, after we come from Arya Star, his tenure being our minister and how it fared. And I'm hoping this side of the story goes much, much better. It's Arya Star saying stability. We're being very, very stable. Very stable. We have our royal hustler, Dr. Bernard Haufiku, who is the founder and current chair of the Africa Public Health Foundation. And we just learned about his background. It wasn't an easy one, but determination is what kept him going. Doctor, you were the Namibia Minister of Health and Social Services from 2015 to 2018. What was that tenure like?
Well, that's another challenge. Public health in Africa, and specifically here, it's not an easy job. But, I used to say we are eating an elephant, so we have to eat it piece by piece, one bite at a time. I was particularly of the philosophy of the so-called development from the periphery. I decided that we need to improve everything that needed to be improved from the periphery, meaning more clinic, more outreach by community health workers right there where the people live, and more capacity building at the community level. I am still pained by the fact that we have a proper clinic in Kaokoland that is not yet functional, and you have a lot of folks there in Kunene that need that services. If you go to Kavango East, for instance, there are two places that sort of pain me. There's one called Samaturu. In Kavango East, there's another one called Saditata. They need that services, and I just wish I could twist something and get things done. They need electricity in the clinic. They need the clinic to be finished. So that's what drives me somehow, to make sure that these ordinary folks, they get services. And then at the district or regional level, my dream was, and I'm still dreaming about it, is that every region should really have a strong regional hospital where people go for care, instead of driving to Windhoek and come and clog up, especially certain cases such as cancer care, or what you call oncology care, dialysis, or even heart surgery. I mean, it can be done at the regional level at one way or another. That has been what has been really worrying me. And from a public health perspective, I believe, as my philosophy as well, that health is how you live your life. And it's what we eat or don't eat, or what we drink or don't drink. So we need to prevent ailment before just waiting for them to develop and try to cure them. We should put emphasis in prevention at the primary care level. And I saw it weakening a little bit, and we moving towards tertiary care, which is not the way to solve public health.
If you could just, in layman's term, what does that mean?
Yeah, public health means, or prevention, meaning basically that you eat healthy.
Yes.
You exercise.
Yes.
You don't abuse alcohol. You don't smoke, and that's basic. Oh, you be careful as well on the road, so that you are not involved in an accident.
Sure.
Yeah, that's basically what it means. And that's what the World Health Organization is actually promoting. That is the health of a population, instead of just the health of one patient who comes to hospital,
one by one,
who's already sick. which is actually late already. You can't prevent.
Yeah. I see that, you highlighted a few discrepancies in terms of the health sector. What can we do as a nation and as a government? Like you said, one of the things was having a functioning hospital in each and every region. Because I actually just last night, a cousin of mine brought a patient from Rundu to Windhoek because they certainly in that region, they do not have the capacity to take care.
Yeah.
So what can we do?
Well, first of all, I think the state alone cannot do it. It has to work with the private sector. I really think that there should be a true collaboration and partnership between the state and the private sector in human resources, in facility management, supply system, everything, financing, everything. There should be that partnership between the two sectors. Secondly, we have to, once again, as I say, we have to strengthen regional capacity in all aspects of care, that we don't shuffle patients from one region. And now the challenge is that we have to build that trust and confidence at community level to be able to believe that I can get my treatment at Rundu, Katima, or Puo, instead of just believing that, I have a lot of patient being brought to me as well in Windhoek, and a lot of cases that can be treated at Oshakati, Ongwediva, and so. So people now need also to believe that they can get that care, and it's us as health professionals who need to instill that confidence in the community.
You're finding yourself now the founder and current chair, Mr. Buxton Busy, of the Africa Public Health Foundation. Tell us about the foundation.
Well, the foundation came from the health agency of the African Union. This health agency is called Africa Center for Disease Control and Prevention. It's modeled on the US one of Atlanta, because US is one who's got a strong Center for Disease Control and Prevention. So after the Ebola outbreak in 2013, 2014, especially in West Africa, where about 11,000 people were killed, the African Union head of state basically directed, but then I was minister, we were actually shuttling the continent from Addis Ababa. We went to Malabo in Equatorial Guinea, and we successfully established Africa CDC. And I was the first board member of that governing council of Africa CDC. With I remember the former minister of Ethiopia was the chairperson, deputized by Professor Adewale from Nigeria. So we successfully established Africa CDC. We recruited the first director general, Dr. John Kongasong, who's now actually the head of PEPFAR, which is the biggest US agency. And then because of bureaucracy of the African Union, Africa CDC felt we need a foundation through which all the funds of Africa CDC can be channeled. And that's how I was approached by Dr. John Nkengasong, together with a colleague from Kenya and the former Minister of Health of Mozambique, Dr. Songane, and we put it together. And they chose me to be the chair, and former ambassador of Kenya to Japan was deputizing me. And we pulled it off, and within 3 years, we actually managed to mobilize about 450 million Namibia dollar.
Wow.
And we dispersed some of this to Namibia, actually, about 22 million. Project Hope, all this NIP and for testing and treating COVID. We mobilized those funds through Africa CDC as a foundation of Africa CDC.
That is so beautiful.
That's what keeps me busy now.
Thank you so much, Doctor, for coming. I can talk to you for hours and hours, because I have follow-up questions, but I know you're a busy man. I'm going to release you, but I'll definitely make sure that I have you back. I was going to say have you back and give you some coffee, but you're not that kind of a doctor. You are your lemon water kind of a man. So, Doctor, thank you so much for coming.
Most welcome.
And we appreciate the work that you're doing for us.
Thank you very much. Thanks, bye.
And that was our former Minister of Health and Social Services, Dr. Bernard Haufiku, who is a member of the executive board of the WHO. And as you heard right now, he is the founder and the current chair of the Africa Public Health Foundation.
Royal Hustlers was proudly brought to you by Namdeb Diamond Corporation.
Good today, better tomorrow.